Hello, my name's Dev Lal, and I'm here talking with my good friend and colleague, Jeremy Latham. Now, Jeremy is an orthopedic surgeon with a specific expertise in problems of the hip. How are you doing, Jeremy?
I'm great, thanks, Dev. Yeah, I'm a specialist hip surgeon based at the South Coast. I was a teaching hospital consultant for 17 years in Southampton, and now I'm in private practice.
Now, my question to you today is really to talk about the sort of recovery period after hip surgery. And particularly for somebody who's older, who might be, first of all, they're worried perhaps about having the operation, and then afterwards it's like, phew, I'm all relieved. They're relieved that it's done. But then, of course, the anxiety as well. Will I be safe to go home? Well, what will I be able to cope with doing, and when will I be, running around without all this discomfort?
Well, the amazing thing about hip replacement surgery is, Dev, that the pain relief is almost instantaneous. People often wake up absolutely aware that their arthritic hip is now no longer a problem. There's a bit of surgical pain, but surgical pain gets better very quickly and is very easily treatable with simple painkillers. You'll be given equipment to take home, such as crutches, maybe even a frame. You'll have a raised loo seat to help you get on and off the loo safely, and be given a helping hand to pick things up off the floor. After about 6 weeks, and this is for everybody, not just older people or younger people, most people are walking independently, they can drive again, they can sleep without any problems. And after about 3 months, the second 6 weeks, they've mostly forgotten they've had surgery. Of course, it can take up to a year or 18 months fully to recover from the operation, because surgery is a complex mix of psychological and physical factors. But we anticipate that and we'll discuss that with you. And also the physiotherapist will see you every week. So after you've had your operation, you go home. The following week you come back, you have supervised physiotherapy, and they take you through that process of learning to walk properly again, how to use your new hip safely and confidently. And that whole process is there to guide people through. It's not just the surgery, it's also the aftercare and support which we provide for patients.
Right. And I think that's a very, very good point, because from our point, it's the same from our point of view, it's from the patient's point of view. It's not just about the operation here. The operation is done, off you go, kind of thing. It's about looking at people as a whole, addressing all the medical problems, any concerns and anxieties they have before the operation, then doing the right operation for the right patient, and then helping them in their recovery, so they recover from surgery and gain their mobility and everything else afterwards, isn't it?
Exactly that, Dev. This is treating the whole patient. It's a holistic experience. And that's one of the nice things about private practice, which of course was one of the reasons I left the NHS, because I couldn't do the sort of work that I do in the private sector. Being able to look after patients from beginning to end, being available to them for when things maybe don't work out so well, or they've got a problem with a wound, being around and available to treat those problems is a hugely important part of the patient journey. So patients know that there's somebody there to help them if things are a bit of a problem or they've got concerns. And that's all part of this sort of holistic practice of surgery. You don't often hear orthopedic surgeons talk about holistic aspects of care, but it is hugely important. If you've got something wrong with you, you want to know that the person looking after you will be there for you if things don't work out so well.
And that's absolutely right, because we've got to look at the whole patient, and it's not just about fixing the hip, it's about giving you your life back, isn't it? Giving you getting rid of the pain, getting your mobility back, and getting you in a position whereby you can get on and live your life and enjoy it the way you want to.
Exactly. So my role is not just to do the surgery, but to guide you through that whole process.
Excellent. Excellent. So if there's anybody out there who would like to get in touch with you, Jeremy, how would they go about doing that?
2 ways, Dev. Come and look at the website, www.lathamhipsurgery.co.uk. If you sign up through the contact form, you'll be sent emails every day giving you top tips and tricks, lots of video content about what to expect from surgery and how to manage your condition. Contact my secretaries, my lovely secretaries, Anne and Tracy, in the office. The details will follow at the end of this. They'll make an appointment for you to see me at the Nuffield Health Wessex Hospital in Chandler's Ford. We can have a conversation, a clinical assessment, get some up-to-date x-rays, whatever needs to be done, and then we can sit down and talk about your condition and what we can do to help you.
Very helpful as always, Jeremy. Look forward to speaking to you soon.
Good to see you, Dev. Take care.